In as much as we see the incidence of TB is dropping in the country, but we still see that there's a lot of people that are dying still from TB. And when we look, we find that, people come late to present themselves for TB treatment or for diagnosis, or even when they have been diagnosed, they don't take the treatment to the fullest, whereas we know that TB is curable. So one of the reasons that we have found that this happens is because of stigma.
The main challenges that they face daily, it's actually discrimination. Sometimes they're scared of being judged because they'll be told that, you made wrong choices.
So people don't come because they are fearing to be stigmatized.
You need now to sensitize a lot of communities.
So as we know, TB stigma actually does thrive on misinformation. It doesn't matter where you live or what you do, you can get TB. As we know, one of the highest risk factors of getting TB is overcrowding and poor ventilation, but the real killers of what we found is the silence. The fact that nobody wants to speak about it, the stigma that's associated about it, and that ultimately results in delay of healthcare and delay of getting treatment. So in the work that we've done, we found that actually that delay in treatment can actually be extended by up to 8 weeks, just because people are scared to come forth, people are scared to come and say, I'm sick. And what happens in those 8 weeks? Number one, it gets spread to other vulnerable people. And I'm talking about our small kids, our elderly population. People get sicker in that period and ultimately die.
The department is one of 4 principal recipients for the Global Fund grant. A big portion of the grant that we receive from the Global Fund is to support TB programming within the country. We implement the TB programming activities through funding NGOs like Isibani to work within the communities.
So what we at Isibani Development Partners aim to do is try to assist in dismantling these stereotypes. And how do we do this? We do this through education and spreading the correct news to the community. So as you can see, we're down in the community today. We want to meet patients where they are, speak to them in a sensitive way, in languages that they understand, so they can get that message that number one, TB is curable. How does it spread? Why is it important for us to screen ourselves for TB? And of course, that we need to seek treatment early.
We're finding a lot of people with TB using the digital chest X-ray screening that has been installed with artificial intelligence that can interpret the chest ray image and can show where there are abnormalities.
To fight against this TB struggle, we may be able to advocate for more policies that are in place as community-based organizations that support vulnerable populations to get access to services that allow them not to get infected with TB.
Through collaboration and partnership with Twin Swallow, we have reduced stigma-related care delays in our district. We have also increased testing uptake using our mobile clinics as well.
We give screening and TB testing with our digital chest X-ray. And for all of the patients that do need healthcare, we ensure that they are linked safely to care to a clinic so they can get that follow-up treatment.
Our community outreach team, they are conducting door-to-door, making sure they are educating people. Breaking down means one conversation at a time. We are seeing the result because we have noticed the reduced number of stigma in our district. And many people are going to facility willingly just for testing and care.
What we need to remember is that the reality is that TB is curable. You can take medication and survive this disease, but we need to shatter all of this stigma and fear that delay us in getting treatment and the treatment that we need.
And don't treat them different. Treat them like any other person because we are all the same. We all have, the same human rights and we all have to access these services.
And this is what Isibani Development Partners is all about. We're here to come down to the community, to screen and give education, but ultimately to create conversations that are going to transform society.
This is a fight we will win because at Isibani, we are not just talking about ending TB by 2030. We are making it happen every day in our communities. The solution starts with you. Get screened, complete your treatment, join our movement.
We beat